In this episode of the Safety Pro podcast, we are going to talk about the CDC Niosh Total Worker Health Program. Traditional occupational safety and health protection programs have primarily concentrated on ensuring that work is safe and that workers are protected from the harms that arise from the work itself. Total Worker Health builds on this approach through the recognition that work is a social determinant of health. Job-related factors like wages, hours of work, workload and stress levels, interaction with coworkers and supervisors, access to paid leave, and health-promoting workplaces, they all have an important impact on the well-being of workers, their families, and their communities. That is total worker health. We're going to get into that on this episode.
Welcome to the Safety Pro podcast, powered by iReportSource, helping you manage safety one episode at a time. With the constant regulatory and workplace culture challenges businesses face, we'll provide you with all the relevant information necessary to achieve a safer, more productive workplace. No management theories, platitudes, or guru speak, just actionable info you can use right away. Now here's your host, the Safety Pro himself, Blaine Hoffman.
All right. Hey, Safety Pros. I'm excited to talk about this topic. I wrote a LinkedIn Pulse article. Oh, gosh, it has to have been a year ago now as this recording is being done. But, I wanted to get into this on the podcast because, it's important to me. It's always been an approach that I've tried to adopt myself, with employers. So I wanted to share it with you. There's a lot to get into with it, but I'm going to send you in the right direction. I'll send you to the webpage. I'll be able to give you a link to the download, the PDF download to the manual CDC Niosh has. But we're going to talk about the fundamentals of total worker health in this episode. Okay, so we're going to just talk about the fundamentals and just kind of introduce you to this concept and put you in the right direction because, again, we could do like multiple episodes on this topic. Keeping workers safe is the foundation on which total worker health approach is built, right? I said in the intro a little bit about it, but total worker health, it integrates the health protection efforts with this, broad, range of interventions to improve worker health and well-being, including workplace safety. So the fundamentals of total worker health, that's a practical starting point for employers, and that's why I wanted to reference that guide for you to get started. All right, so there are 5 defining elements of total worker health. Number 1, demonstrate leadership commitment to worker safety and health at all levels of the organization. Sound familiar? Number 2, design work to eliminate or reduce safety and health hazards to promote worker well-being. Again, sounds pretty familiar, straightforward, right? Element number 3, promote and support worker engagement throughout program design and implementation, right? So worker engagement, worker involvement. Number 4, ensure confidentiality and the privacy of workers. And here we're going to get into that. We're going to talk about, their health issues and stuff, right? And number 5, integrate relevant systems to advance worker well-being. Now, these all sound pretty basic, pretty generic, okay? We've heard these 5 elements before. What makes them so unique in the context of total worker health? Well, we'll get into that, but you have to get started. And what Niosh recommends is that you create a team of people who know about different policies, programs, practices in your workplace that will ultimately impact worker safety, health, and their well-being. So draw team members from all levels of that workforce. Consider workers who have requested or participated in changes for safety and health, safety and health managers, directors, human resources representatives, any kind of occupational health nurses you might have on site or contracted with, any other, healthcare practitioners, workers' compensation professionals, your TPA, your managed care organization, if you have claims adjusters, claims managers, in-house, if you're self-insured, any EAP program, professionals, I should say, EAP program. It's like ATM machine. It's redundant, right? We know that ATM, M is the machine. All right, I digress. But EAP professionals, any staff responsible for, disability management in the company, temporary, any kind of, return to work procedures, health and wellness champions. The list goes on, but you really need a pretty diverse group of folks to sort of assemble around this program, this approach, right? Total worker health. So let's dive into the first element, because I kind of alluded to it before. Like, all right, all these elements sound pretty basic and standard. We're already doing these. The question is, are you doing them in the context of total worker health? Okay, you may be doing them in the context of OSHA, in workplace safety. So let's add a layer of complexity to this. And I don't mean complexity in a bad way, but, I mean it in a good way. So, let's define element number one, that first element. Demonstrate leadership commitment to worker safety and health at all levels of the organization. Organizational leaders, should acknowledge and communicate the value of workforce safety and health as a core function, and should prioritize worker safety and health on the same level as quality of the products or services that we deliver. We get that, right? But here's a pro tip. Middle management is the direct link between the workers and upper management, and they play the critical role in any program success or failure. I don't care if it's safety. I don't care if it's quality. I don't care what it is. That direct supervisor, that's where the money is right there, okay? Your success or failure is in large part going to rest at that little spot of the organization. So we need to spend time developing and preparing them for changes like this. Here's an example. Supervisors often serve as this gatekeeper to employee participation in programs. And when program involvement competes with productivity demands, which one's going to win, right? They may discourage participation, indirectly even. So that's why they're critical, okay? Effective programs thrive in organizations that promote respect throughout the organization and encourage active worker participation, input, and involvement, period. Leaders at all levels of the organization, they can help set this tone. But look, I'll be honest, everyone, that's from managers down to the frontline workers, boots on the ground, as my friends over at the Amplify Your Process Safety podcast would say, boots on the ground. They play an important, critical role in contributing to the shared commitment to safety and health. They are in it, okay, just as much as top management or, executives. So beyond written policies, any stated practices or, implemented programs that you have that endorse safety and health in the workplace, you got to consider the extent to which your organization's spoken and unspoken beliefs and values, they either support or deter worker well-being, okay? You have to look at that. And we've said it 100 times. We'll say it 100 more, I'm sure, or more than that. It's one thing to hang a banner on a wall that says safety first, safety starts here, or whatever. And it's another thing to live by that, to actually speak that through actions and behaviors. Okay. And another colleague, I may have mentioned this on a previous podcast, but another business leader that I'm familiar with that listens to this podcast, he'll know. I don't want to name him because it's just coming to mind. I haven't cleared it with him. But he mentioned this in a meeting we had, and it's so true. Walls don't speak. You can hang this stuff on banners and posters, but you have to live it. You have to set the example through our actions and, our beliefs and every day when we go to work. So don't discount the unwritten, values that we have, right, in the workplace. So top leaders, I'm going to encourage anybody that's in that category, establish and clearly communicate the principles of the proposed initiatives that you launch. In this case, we're talking about total worker health, but it goes for anything. But, make sure you communicate the principles, the why, okay, at all levels of the organizations. Teach managers to value the workers' input on safety and health issues. You have to teach them that. And that's how these frontline supervisors are going to get it. We have to empower them, but we also have to equip them with the skills to be able to carry these things out. Maintain the visibility of the initiative at the organization's highest levels by presenting data that is linked to the program's resource allocations. So promote routine communications between leadership and employees on issues that are related to safety, health, and well-being. Make sure you can tie an ROI to the reduction in healthcare costs that can actually be passed on to the workforce if we could address, wellness outside of work. But guess what? It starts at work, and we're going to get to that. So that was the big aha moment I had years ago when I was able to make the connection, when wellness folks and HR folks were just upset that nobody would show up to their yoga class. And when I started going out to the floor saying, hey, did you know they have a yoga class? And they would just look at me and go, what are you, nuts? I've been standing here for 12 hours, my entire shift on a concrete floor, and you want me to go do yoga or go work out when I'm done? And then it hit me. Wait a minute. We need to bring the approach that the wellness team is trying to what they're trying to do. We need to bring that to the shop floor where the workers are doing the work before we can expect to ask them to participate in things beyond work, right? So let's fix the workplace first. Let's get their engagement, their involvement. Let's get their buy-in. Let's see some success there. What that gives us is credibility. I'm getting ahead of myself here on the podcast. I can't help it. But that hit me. That was my aha moment. So when I say, be able to tie, upper management needs to be able to tie these things together, use data to make the connection between the efforts we're trying to launch out on the floor to, what we expect to see in the business. That's one of them, is just overall wellness and just the human element. But you could easily pull data and talk about lower comp rates, lower, partial disability or permanent disability claims down the road, the total lifetime value of our workers. If, we want them to stay at this company for 15, 20 years or more, what condition are they going to end up in 25 years when they retire? And who's, the cost to not just the company, but society. I mean, we have a huge role to play in that. So there you go. Holistically speaking, I'll get off the soapbox, but look, openly support and participate in workplace safety and health initiatives. Again, top leaders, openly support and participate in workplace safety and health initiatives. When I see the VP of manufacturing in the gym, in the on-site gym during his break on the treadmill, that says something. So when he says, I would encourage everybody to, do what you can to participate in, I know he means it because I've seen him, and I'm talking about, somebody in particular. I'll have to reach out to him and mention that I actually said that on the podcast, but it stuck with me. It left an impression, and it says something when they openly support and participate in the initiatives themselves, right? That's going to help facilitate participation across all levels of the workforce. Add safety and health related standards into performance evaluations of your supervisors. So top leaders should add safety and health related standards into the performance evals of their managers. Build safety and health into the organization's mission and objectives, and establish a mechanism and a budget, by the way. I'm going to add budget for acting on workforce recommendations. Emphasize that shortcuts must not be allowed, or they can't compromise worker safety and health. So look, we can't pay for everything all the time, but what interim protections are we putting in place until we can establish a budget, get money for some machine fixes that, are going to be somewhat costly? We still have to drive this expectation of, it doesn't matter if we don't have the money today, we are going to do something before we start that machine again tomorrow. Finally, this is top management, provide the resources needed to carry these things out. Not just the money, we talked about the funding, but appropriately trained and motivated staff, vendors, consultants, even the space needed to have meetings, trainings, things like that. You could show some support just by giving us the time and resources that we need to do the work that needs to be done, right? Now let's talk to mid-level managers, frontline supervisors, okay? Look, you need to recognize and discuss the competitive advantage, like recruiting, retention, employee satisfaction, community engagement, the reputation of the organization, the workforce sustainability, all that stuff. You have to recognize the competitive advantage that total worker health brings to the long-term sustainability of the organization. If you're tired of employee turnover, you need to take, stock in yourself. You need to take an inventory of, starting with yourself. Am I creating the conditions that lead to people churning? What can I do to keep people to stay, right? What benefit can I build into the position that is free oftentimes, that just involves culture, that just involves work environment, and that is my interactions with them. And so one of the easiest and cheapest employee benefits is just caring about the people that work for you, period. And how you do that is quite simple. You actually care about whether or not they're injured or ill or comfortable at work, the tools are the right tools, that machine's not giving them trouble. I mean, you're there to support their work, to support them, right? You work for them. So it's a mindset that you have to adopt. They don't work for you, you work for them. They are there for one reason and one reason only, and that is to produce whatever part or provide whatever service or to build whatever, building. And if you're in construction, it doesn't matter. That's why they're there. Your job is to facilitate that. And you're there to coach them as well and to support them. But also when they misstep, you're there to find out what could we do to prevent that from happening again? Where did we let you down? Truly rule out that it was an employee's fault. I mean, that's the first thing we want to go to, right? No, it's a mindset. What can you do to recognize the competitive advantage that approach is going to bring to the organization? Another thing you can do is highlight examples of senior leadership's commitment to total worker health. You can carry the water for senior leadership. Not that you're going to be a yes man or a yes woman. That's not what we're talking about. What we're talking about is you are that go-between. You're the connective tissue between, and don't take this the wrong way when I say the bottom of the organization and the top of the organization. I think you know what I mean by that. The frontline workers and the top-level executives, you're that connective tissue, okay? Not a filter, not the bearer of bad news. You're there as a conduit between those two areas of the business. And it's a two-way street, by the way. You're also supposed to advocate for your people to top-level management, okay? And it can get uncomfortable sometimes. I know. I've been there. But that's what it is. And that's why I say that middle manager, that frontline supervisor is probably the most important role in the organization, because that's where it all falls apart. And we've seen that. I want to hear your thoughts on that, by the way, on LinkedIn or via email. But give me your thoughts on that, the whole middle management frontline supervisor thing. I don't think our industry, that we pay enough respect to that position in terms of not pats on the back, but in terms of investing in them, in the development, professional development of that role, of that person in that role. And the third thing that mid-level management can do is provide training on, how other managers can implement and support total worker health. All right, let's go to element number 2. Design work to eliminate or reduce safety and health hazards and promote worker well-being. So we know that we've heard this so many times before in safety, but what does it mean for total worker health, right? So a total worker health approach, it prioritizes a hazard-free work environment for all workers and applies a prevention approach that is consistent with traditional occupational safety and health prevention principles of the hierarchy of controls, right? Eliminating or reducing recognized hazards in the workplace first, including, those related to the organization of the work itself. That's the most effective means of prevention and is the foundation to all total worker health principles, just like we see in occupational safety. Although some hazards can be eliminated from the work environment, others, like shift work, they're more difficult to change. And this is where we get into total worker health, and that's where occupational safety stops. We talk about physical hazards. What about shift work? And by the way, if you want to get some more information on one of the biggest hazards associated with shift work is fatigue. I did an episode on fatigue management plan, effective fatigue management program, but you can check that one out. That's an example right there. That whole podcast is an example of what we're talking about with total worker health. We need to think, as safety professionals, we need to think beyond physical safety, physical workplace safety. We need to take into consideration these other things, because oftentimes when we have an accident or incident at work, when we talk about somebody's tired, didn't get enough sleep, and we're like, that's on you, pal. Well, I don't know. Is it? We have forced overtime, and maybe did we capture the last time this person worked a shift before this shift started? Did we capture that on our incident report? Is that something that we check to make sure that we rule that out? So that's total worker health, is looking at those types of things, going beyond the work environment, such as shift work, right? So we've got to manage these through various engineering and administrative, or at the very last resort, individual level changes. But workplace programs that adopt a total worker health approach, it emphasizes elimination or control of workplace hazards and other contributing factors like poor safety, health, well-being, shift work, things like that. This emphasis on addressing environmental determinants of health is a crucial concept for total worker health. So we're adding, that's why I said earlier, we're adding this, a level of complexity to what we have to do. And I mean complexity in a good way. So the hierarchy of controls applied to Niosh, the total worker health, it provides a conceptual model for prioritizing efforts to advance worker safety, health, and well-being. And this applied model is based on the traditional hierarchy of controls that's well known to us safety pros. But as in the traditional hierarchy of controls, the strategies are presented in descending order of anticipated effectiveness and protectiveness. So it's going to have some cascading arrows instead of just the hierarchy of control like a triangle. It's going to have some arrows that go down slightly different. I'll have a link to this image, by the way. But the hierarchy of controls applied to Niosh total worker health, it expands the traditional hierarchy from occupational safety and health to include controls and strategies that more broadly advance worker well-being overall. So that's the difference in this hierarchy of controls graphic that I'm going to share with you. So be sure to download that, study it, and add some of those things to what you look for when you do hazard assessments, risk assessments, or incident investigations. Look for some of these contributing factors beyond traditional workplace safety. All right. Keep in mind that hierarchy of control, right, it's not meant to replace the traditional, the one that we use, but rather a companion to it. So you use them both together. It just serves to illustrate how total worker health, how it emphasizes that organizational level interventions to protecting the worker safety, health, and well-being. All right. Now, in order to apply this model, begin by eliminating workplace conditions that cause or contribute to worker illness or injury, or otherwise, negatively impact well-being for that matter. These could include factors related to supervision throughout the management chain. All right. So look at that. Second, replace unsafe or unhealthy working conditions or practices with safer, health-enhancing policies, programs, and management practices that improve the culture of safety and health in the workplace. Next, redesign the work environment where needed for safety, health, and well-being. So, remove impediments to well-being, enhance employer-sponsored benefits, provide flexible work schedule. I mean, it's getting into that kind of stuff, right? You're going to have to partner with HR and the benefits team and, upper management. This is going to move the safety professional into a whole nother level in an organization, which in my opinion is a good thing. That's where we need to be sitting. We need to be sitting at a much higher level in most of these organizations. So that's been my experience. Okay, then provide safety and health education and resources to enhance individual knowledge for all workers, top level, mid-level, boots on the ground, okay? And lastly, encourage personal change for improvements to health, safety, and well-being. Assist workers with individual risks and challenges and provide support for healthier choice making. Safety pros, you're going to have to partner with your wellness and benefits team, okay? You're going to have to take this total worker health approach. And that's going to get tough. That's going to get tough. If you're sort of on the low end of the culture continuum, another podcast I did where there's a download, where you can download this culture continuum, you can see where you are on this. But you're going to have to do some work on workplace safety culture development first before you can get to this stuff. All right. And that goes back to what I was harping on earlier, which is, look, benefits people, HR people, if you want to see success in off-the-job safety and wellness and health efforts, you have to first establish a culture of workplace safety. So you have to do that first. Okay. So I'm giving you somewhere to start. Take a complete inventory and stock of where you are today compared to where like total worker health expects you to be. How far off are you? That's the gap you work to close. Okay. So you manage from where you are, not where you wish you were. You have to know where you are right now. All right, so that's how you work that hierarchy of control and get that graphic. It'll explain it better as you move down the pyramid with the arrows. That's how you get there. I'll just do an example. I'll give you an example. All right, we're going to use the hierarchy of controls that Niosh uses for total worker health, okay? Let's say we're going to target MSDs. Ergo, we'll go with ergo, right? Because that's a big one. That brings up a good point. Do you know how many back problems and issues that people have they think are not related to work, and it's driving up healthcare costs for the company and for the employee, but that are actually could be worsened or exaggerated at work that we could address? So let's use that as an example, like ergonomics or musculoskeletal disorders, right? So number one, redesign the work to minimize repetitive movement, excessive force, awkward postures, lifting, things like that. So that's step one, right? Redesign the work. Step two, provide ergonomic consultants, assessments, make sure that you work to improve the job and the workstation design and interface that you do in step one, along with training in ergonomics principles and opportunities for workers to participate in the design efforts themselves. So that's step two. Step three, evaluate the profile of and the health needs of the workers. Maybe the age, weight. I know it's getting into some sensitive stuff here, but look, it's fitness for duty, right? We do this all the time. A lot of companies have physicals, pre-employment physicals. I see job postings all the time. It's like, hey, you got to be able to lift 50 pounds, So, you can do this tactfully, but you're going to want to look at the age profile, health needs of the workforce to provide education on self-management strategies, including preventative exercises for arthritis or other MSD. Hey, look, if you're fit, right, you're going to be fit for duty. We had this in the fire service. You had to be fit for duty. And if you take care of yourself outside of work, you eat well and you exercise, and so you're going to be able to work better, not necessarily harder or longer, but you're going to be a little more resilient to the work that lies ahead. So this is where you're going to need to partner with your health, wellness, and benefits team. Okay, so that was number three. Evaluate, the profile of your workforce to see what kind of education strategies need to be deployed. Right. So a total worker health program reducing work-related stress might consider the following: implementing organizational and management policies that give workers more flexibility and control over their work schedules, and as well as opportunities to identify and eliminate root causes of stress. Provide training for supervisors. Number two, provide training for supervisors on approaches to address stressful working conditions. And number three, providing skill-building interventions for stress reduction for all workers and providing access to employee assistance programs. So that's an example of how you can take that total worker health approach. So let's get on to element number three: promote and support worker engagement throughout program design and implementation. Look, ensure that workers are involved in daily operations as well as the supervisory staff. Make sure they're engaged in identifying safety and health issues. They have to contribute to the program design, of course, but also participate in all aspects of the program implementation and evaluation. So again, let workers be involved in workplace safety, health, and well-being instead of just being, recipients of services, right? This is going to nurture a shared commitment, and it's going to yield better results, trust me. So how do you do this? Some ways, just a few. Identify safety and health issues that are most important to frontline employees. Ask them, do a survey. They'll tell you what bothers them the most about a job. Because sometimes you got to take it with a grain of salt, but look, you got to go in this honestly. They have to believe that you're going to listen to them, to what they have to say. What about this one? Identify potential barriers to program use and effectiveness. Are we good, using air quotes here, at identifying what's stopping people from participating? Okay? Not giving them enough time, training, resources, whatever. You can also improve the long-term sustainability of initiatives and increase employee buy-in and participation in policies and other interventions by addressing those barriers. So that's key. Remove the barrier, floodgates open, you'll get people participating. Of course, I make it sound easy on the podcast, but look, it's work. It's hard work, and you're just going to have to get started. So do what you need to get started. Here's a pro tip. Design programs with a long-term outlook in mind to ensure sustainability, all right? Short-term approaches give you short-term value. Programs that are aligned with the core values of the organization, they're more likely to last longer, and they should be flexible enough to be responsive to changes in the workplace or the market conditions. As workplace hazards and exposures change, the needs of the individual workers can adapt as well. Look, bottom line, a participatory approach can help in this regard, but keep sustainability in mind for the bigger picture, okay? Don't go designing something that you know is going to just last a couple of weeks and that's it. Design for sustainability in mind. Okay, to help encourage worker engagement, communicate strategically. Everyone with a stake in worker safety and health, that's the workers and their families, supervisors, etc. They have to know what you are doing and the why. That is important to buy in. They have to understand the why. Tailor your messages and how they are delivered. Make sure they are consistently reflecting the values and direction of the initiative itself, that it's aligned, with the organization. So keep that in mind. Tailor that, okay? Whether workers are willing to engage in workplace safety and health initiatives may depend on their perceptions of whether the work environment truly supports safety and health. Here's an example. I found this one really interesting. One study found that blue-collar workers who smoke are more likely to quit and not start again after a worksite tobacco cessation program if workplace dusts, fumes, and vapors are controlled and workplace smoking policies are in place, banning smoking, on the campus at all. Look, it goes along with what I said earlier. Don't lament the fact that nobody wants to sign up for the yoga class after a 12-hour shift of standing on concrete floors with a sore back. Okay? It's the same thing with this. Don't be shocked if nobody participates in the smoking cessation policy when you have a dusty, dirty environment at work. Okay? So it starts at work. It starts with workplace. All right. Element number 4, ensuring confidentiality and privacy of workers. Designing and enforcing appropriate privacy protections, it goes way beyond simply ensuring that only authorized personnel have access to sensitive safety and health information. Obviously, we have to observe I'm going to give you the boilerplate statement here, all, relevant local, state, and, federal laws regarding privacy and personally identifiable information and health-related information by taking the appropriate steps that most businesses take. So doing things like masking personally identifiable information on reports that are distributed or emailed or sent out, using a digital management system that is encrypted and protecting the users with passwords, those are some best practices that you can use, okay? Just make sure that you don't discuss personal health cases with people without permission. Just keep in mind that's an important aspect of this, and it's going to give the workers confidence to participate. It's one of the barriers, by the way. They don't feel like their information is going to be kept confidential. So data sources that require confidentiality considerations or protection include the following: health risk assessments, electronic health records, of course, management systems, program evaluation data, self-reported survey data. Okay, if they participate in those, got to keep those under lock and key, confidential. All right. Privacy precautions to take. You've got to have some rigorous de-identification of records. Make sure you mask sensitive information if you have to have records to review. Okay. Destruction of personally identifiable information as appropriate by law. Hiring a third party to handle certain aspects of the program to reduce employee fear of retribution or penalty, or just being embarrassed about health. Having the bus and van to come out to do the bioscreening stuff, where it's confidential. They keep that. That's a medical document that we don't even have access to. We're just providing that as a service to the employees. That helps boost confidence as well. Using group or population level data rather than individual data. That's the big one that a lot of people miss. You can also get skewed by that data too. So you can go down a rabbit hole with group data or population level data. You can start initiatives that only affect a small segment of them, but because it's got a high impact on claims costs, that it's gonna pop on a cost radar when only 3 people have that problem in your population, and you're rolling out this program to address it. So look, you just got to be careful. Look at different data sources. Make sure you interpret the data appropriately, and just be smart about it. So element number 5, integrate. We're nearing the end here, folks. Stay with me. Integrate relevant systems to advance worker well-being. Look, total worker health emphasizes the role that organizations have in shaping worker safety and health outcomes, while recognizing that a multi-level perspective that includes policy, environmental, organizational, and social concerns may be best for tackling complex challenges to worker safety, health, and well-being. So integrating data systems across programs and among vendors, for instance, can simplify monitoring and evaluation while also enabling both tracking of results and continual program improvement. Look, consider ways to integrate relevant systems with your organization, right? I listed 3 things here, and I'm going to read them for you right now. 1, conduct an initial assessment of existing workplace policies, programs, and practices relevant to safety, health, and well-being, and determine how they relate to one another. Now, for some larger organizations, this might seem like an overwhelming task. So to assist in helping to focus this step, consider at a minimum human resources or personnel policies on issues like health insurance, paid sick leave, family leave, vacation benefits, retirement, disability, right? Safety and health policies and procedures can be considered for identifying hazards, reporting work-related injuries and illnesses, and filing workers' comp claims and how they're related. So number 2, identify obvious areas of overlap with existing efforts and note opportunities for future coordination. Man, I saw this all the time. I would want to start an ergonomics team, and here we got wellness, and I didn't even realize it. We got the wellness folks are trying to have this vendor come in and go to workstations and look at how they're standing and sitting so that they can do a class at break that's voluntary. And I'm like, stop, can't do that. If we identify a problem at the workstation, we are required by law to fix it, to address it. So no, stop. We first have to take care of them at work. Then we can build on that success with the wellness pieces. So it was very frustrating. It actually opened up the company to some liability, in that regard. Think about it, because we're not doing any. We're like, oh, wow, yeah, you're bending over a lot picking these boxes and these parts up. So we're going to take that information back, talk amongst ourselves, and we're going to get this little yoga instructor to come in and do some stretches that would benefit the back. And by the way, we're going to make it available on first shift Tuesdays and Thursdays at, from 1 to 1:30, and it's voluntary. It's not going to work. You're lucky if you don't get sued. But look, if that's a recognized hazard, we're required by federal law to address it, period. So make sure you identify obvious areas of overlap with existing efforts and note opportunities for future coordination, right? Number 3, purposefully and regularly bring together leaders and teams with overlapping or complementary responsibilities for planning and priority setting. For example, hold joint meetings of safety committees and occupational health staff, HR, and wellness committees. Have a big jam session once a quarter with all 3 of those committees. Because darn well they're talking about the same stuff, the same problems that they're seeing. They're trying to go at it different ways. Get together every once in a while. You'd be shocked at what you can achieve together. Alrighty, questions to consider asking yourself or your team related to total worker health. Do we regularly seek input from workers on the selection and design of our offered benefits? How can we change or adjust management policies or programs to more effectively support improved safety and health? How does the everyday physical work environment affect workers' safety and health beyond our workplace policies or programs that may be targeting safety and health? What influence do our workplace or organizational norms have on worker safety and health outcomes? And how do our efforts feed into the community at large? What sorts of resources outside of the workplace, like community support, would be useful in helping to reinforce and support our safety and health programs? Like, you don't have an on-site gym, but you can partner with the local Y down the road to offer discounts, or to maybe do a free class, once a month to get folks in there. Stuff like that. Part of benefits, have your benefits and wellness folks reach out. But understanding the connection between various systems and levels of an individual worker's experience may be helpful in designing creative, well-rounded approaches to safety and health challenges. So don't forget that, okay? By working together and discovering what each professional in the organization is already working on, you're going to often find related goals and objectives. That's worth repeating for you, okay? The benefits administrator struggling to get workers to participate in an exercise class, and the safety professional struggling to get a warm-up or stretching program started, you're going to be able to work together, all right? So don't forget that. You're not alone. Get a team together. So put a pin in this topic, and I will say this. If you want to have a successful wellness program, you have to first have a strong culture of workplace safety. That's what you can take to the bank. Write that down. I guess I could have saved you a whole lot of time and just said that and, hit the stop button. But look, once you do that, then you can build on that credibility and ask folks to move towards participating in safety or health-related activities off the job. Make sure you're building a workplace safety culture, okay? Check out the links in the show notes. Let me know what you think. Reach out on LinkedIn. If we're not a connection already, I want to connect with you, so go ahead and do that. And do me a favor. If you enjoy any of the information in this podcast, go ahead and tell somebody that you know in your network that might benefit from the information. This is a word of mouth. I do this. It's a labor of love. Look, I don't have anything to sell you, but this information I'm providing to you. So if you find value, maybe share it with others. That's all I can ask, right? And until the next Safety Pro podcast episode, as always, please be safe.
Thanks for listening to this episode of the Safety Pro Podcast, powered by iReportSource, the all-in-one digital safety solution. For info on how you can request a free demo on all the capabilities of iReportSource to streamline your business's safety management system, head over to thesafetypropodcast.com. We look forward to helping you manage safety on the next episode of the Safety Pro Podcast.